Hi friends, welcome to my channel Sharing Simple Knowledge. Today I am going to discuss another case note. This is a letter to an oncologist. So let's read together what are the information has given in the case notes. So as you know, there are 5 minutes allotted for the reading time and the writing 40 minutes. So during this reading time, we take pen or pencil in our hands, but we can plan the points, the relevant information, irrelevant, you can segregate them during that time. But when they announce that you can start writing, the 40 minutes starts, still you have to take at least 5 minutes to plan your skeleton of the letter. It will help you to improve the writing speed because once you have planned and made a skeleton, you may not need even 35 minutes to write the letter. So you can get the time for proofreading as well. So before your examination, you have to practice this method. So let's do this letter, how to write it. First, read the case note and complete the writing task which follows. So what all the information we have to check first? What is your position in this letter? So here it is mentioned you are nurse in charge in Trinity Hospital, Melbourne. Who is your patient? Mr. Vince Gilligan is one of your patients. Then next we have to see to whom we are going to write. So where you have to go? You should check in the writing task. So using the information given in the case notes, write a letter to Dr. Kim Harrington, oncologist with McCallum Cancer Care Center, Melbourne, Australia. So we understood that we are going to write this letter to an oncologist. So we should include only the relevant information which an oncologist must know or should know. Don't include the relevant informations. Then what are the other? Briefly outline Mr. Gilligan's condition and progress. So we have to inform. Then they have given the instruction here. In your answer, expand the relevant notes into complete sentences. Even though in the case note maybe they have put something in the bracket or something like that, we should not follow that. Okay? We have to write elaborately in a sentence. Do not use note form. Use letter format, and the body of the letter should be approximately 180 to 200 words. Be careful always. The number of the letter should not be less than 180. Sometimes when we get the known case, we should not include the social history or medical history because the reader already knows the patient and he knows these informations. So what we have to do, then we can just elaborate the symptoms, or even though he is aware with that one, we should elaborate it. Otherwise, they may penalize you and you can get only 290 for your writing. Even though you scored well in the other module, it can affect your grading. So be careful. So we understood our position and the reader's position. So we are nurse in charge in Trinity Hospital where Mr. Vince Gilligan is one of our patients, and next we are going to write to the oncologist. So the discharge date, that is the exam date they are giving. Today's date is 22/5/2020. So no need to worry about the date. It will be the exam date. Then patient details. Name Mr. Vince Gilligan. The age is 59 years. Address Vince Residence, Purple Street, Melbourne. Diagnosis oligodendroglioma. Post-op craniotomy status. Then social background. He is a lawyer married to Mrs. Eliza Turner. 2 children. No medical illness. No social habits. Active lifestyle. Admission date is 11/5/2020. So from this all information, we have to make sure what all information we have to use. So the name, the date, of course we have to, then the name, age. No need for this address, but the diagnosis is important. Then the social background, it's irrelevant. We can just try unremarkable trait that even if we need to make the word count. So the admission date is important. Then what else? Informations are given here. Then presenting complaints. History of progressively increasing headache and vomiting approximately for 3 months, 3 to 4 episodes of convulsions, changes in memory and behavior noted by wife, assessment signs of raised intracranial pressure, evidence of frontal lobe dysfunction, investigations MRI done which revealed glioblastoma with a severe mass effect. Then blood investigations were done, nothing significant. Then progress and management. On 12th May, craniotomy and microsurgical removal of the tumor done. Post-operative recovery, mild speech impairment. Hemodynamically stable, antibiotics, antacid and painkillers. Assisted self-care, speech therapy. These are the management done. On 18th, he able to walk independently. No signs of SSI. Do you have idea what is SSI? SSI means surgical site infection. It's a complication, post-operative complication. So always make sure you know the abbreviations. So the acronyms, you have to practice the acronyms, so then only you can answer the question very well, because if you don't know what is SSI, you may be confused, you may think something else. So you don't know whether this information has to include in this letter or we can omit it. So just try to practice many abbreviations and acronyms. I have done some videos in my channel also. If you need, you can just practice that one. There are a lot of videos available in this YouTube channel itself. So antibiotic stop, speech improved, plan for discharge after 4 days. That means the discharge date is already mentioned, 22 May 2020. Then what are the other informations? Histopathology result came grade 3 anaplastic oligodendroglioma, radiation therapy and adjuvant temozolomide chemotherapy. That is the plan. Reference oncologist for further treatment and follow-up care. So the writing task we already read, that is the write a letter to Dr. Kit Harrington, oncologist, Peter McCallum Cancer Care Center, Melbourne, Australia. You have to briefly outline Mr. Gilligan's condition and progress. So we understood what all information we have to include in this letter and how we can write it. So let's see how we can write this letter with an example. So of course we have to write the address and the reader's name. Dr. Kit Harrington, oncologist, Peter McCallum Cancer Care Center, Melbourne, Australia. Then the date is 22 May 2020. Dear Dr. Harrington, because the name is already mentioned there, so we can use Dr. Harrington. Then who is the reference is Mr. Vince Gilligan, age 59. Then how we can write the introduction. The purpose of writing this letter is to refer Mr. Vince Gilligan, who has been diagnosed with grade 3 anaplastic oligodendroglioma. Then he requires further for further care and radiation therapy or chemotherapy we can write, or even treatment following his discharge today. You know why we use who has been diagnosed? Because we know this is a brain tumor, so it is a long-term disease, so we can use who has been diagnosed. But if it's some pneumonia or like that which can be cured in period of time, we can write it who was diagnosed. That's the difference. For the short term period like that, here we know it's already diagnosed and we are treating and it will cure soon, so we can use who was diagnosed. I think it's clear for you until now. Then let's move on to the next para. Initially, Mr. Gilligan was admitted to our facility on 11 May 2020 with 3 months history of gradually worsening headache and vomiting. In addition, he had 3 to 4 episodes of convulsions followed by memory loss and behavioral changes. On examination, signs of increased intracranial pressure and frontal lobe dysfunction were noticed. A magnetic resonance image, but if you are writing, it's better to elaborate don't use the abbreviation. So if you are an MRI, even though it's M, but the sound is like the M, vowel sound, so we have to use an. But here we are elaborating this, I use a magnetic resonance image revealed glioblastoma with severe mass effect, for which he underwent a craniotomy and the tumor was excised. Just try to use synonyms as well in the letter. Don't copy the same case note. It may affect your scores. Then next we can write Mr. Gilligan's post-operative period was uneventful except mild impairment of speech. Currently, he can ambulate independently and his speech has improved after speech therapy. That are the progress what we have observed. Then next we can move on to the recommendation. In view of the above information, even in view of the above or considering the above, it's enough, but to maintain the word count, we are just using in view of the from above information. It would be appreciated if you could take over the care of Mr. Gilligan and provide radiation and adjuvant temozolomide chemotherapy. Kindly note that his social and medical history are unremarkable. This only two for the word count we are writing, otherwise it is irrelevant. No need to mention, because if we didn't write, that means it's unremarkable. Then we can write, please do contact me if you require further information regarding Mr. Gilligan. Usually we are writing, please do not hesitate to contact me if you have any queries like that. But as an oncologist, he doesn't want, we can write any doctors like that. We can write, please do contact me if you require further information regarding Mr. Gilligan. Then as the name of the receiver is given, we can use yours sincerely, leave a line, then nurse in charge. No need to mention the hospital name, and it's usually in the official site of OET website they are telling that your position, that's enough. So I think it's clear for you. Thank you for supporting me, and also I'm so happy that at least I can help some people in their journey to achieve their dream. So keep supporting me and watch my channel. And if you are watching the first time, please like and subscribe. If you have some queries, you can comment below in the comment box. Thank you. Bye.